U.S. President Donald Trump has threatened to cut funding to the World Health Organization permanently unless it implements substantive improvements over the next 30 days. In a letter to the Director General of the WHO, Trump says that the organization gives, quote, terrible advice for fighting the coronavirus and accuses it of being too close to China. The U.S. president has also said that he is currently taking the anti-malaria drug hydroxychloroquine. Now, Trump has repeatedly touted the drug as a treatment for COVID-19, despite warnings from medical experts about its potentially dangerous side effects.
But I get a lot of tremendously positive news on the hydroxy, and I say, hey, you know the expression I've used, John? What do you have to lose? Okay, what do you have to lose?
So I
have been taking it for about a week and a half.
Every day?
At some point, every day. I take a pill every day. At some point, I'll stop. What I'd like to do is I'd like to have the cure and/or the vaccine, and that'll happen, I think, very soon.
And let's get more now. We are joined by DW correspondent Stefan Simons, who is in Washington. Stefan, a lot to unpack there, but let's start first with the president's letter to the head of the WHO. How significant is this?
It is significant. It is the second shot against the WHO and against China. Let's not forget. That is what is seemingly behind this action. The president had about a month ago already blamed the WHO of being basically the right hand of China in masking what the truth is in his mind, and that is that the virus comes fair and square from China, and that China failed to inform the United States and other countries early enough about the significance and the danger of the virus. Now this is the second one, the second shot, so to speak, against WHO, that the WHO does the bidding for China. And that comes just days after China said they are more than happy to fund the WHO investigation, as also more research into where the virus not only comes from, but how dangerous it is. Well, everybody knows how dangerous it is. It killed by now 90,000 plus Americans and countless other people around the world. For the president, this is also very, very important politically speaking, because it caters to his clientele, it caters to his followers. They blame China also as being the enemy who brought, so to speak, the virus to America. And the president is using this politically, strategically to his advantage.
And meantime, we have the search for a treatment, a search for a vaccine. And at the White House, President Trump surprised reporters as he was wrapping up a meeting to announce that he's taking hydroxychloroquine. That's, of course, the anti-malaria drug that he's been touting to ward off coronavirus. What happened there?
Yeah, good questions. What happened there? This came a little bit as a surprise for everybody. As you said, he's promoting hydroxychloroquine for the last 2 months as something people should really use. And you remember this came before, just shortly before, he then also suggested people should maybe drink some disinfectant to clean their lungs and to be preventing any infection from the coronavirus, and repeat drinking this. But you're right. Still, the FDA and government agency does not recommend anybody using hydroxychloroquine in a not controlled with doctors and a clinical environment. The president here also sees and finds that that those rules or recommendations do not apply to him.
And we know that U.S. health officials have expressed skepticism about hydroxychloroquine as a treatment. Stefan Simons joining us from Washington with the view from there. Thank you. And let's have a look at the latest developments in the coronavirus pandemic. Unemployment has skyrocketed since the pandemic began. Newly released numbers in the United Kingdom show jobless claims there jumped to more than 2 million in April. That's the highest level since 1996. In Chile's capital, Santiago, protesters have clashed with police over a lack of food and essential supplies. The lockdown has forced many people out of work. And France is reporting a dip in deaths from the virus, but also a slight uptick in confirmed cases. People are urged to continue social distancing as other restrictions are eased. France and Germany have announced a €500 billion plan to help Europe weather the worst crisis in decades. The proposal calls for a rescue fund to boost the sectors of the economy hit hardest by the coronavirus lockdowns. It's an about-face for the German Chancellor Angela Merkel. For weeks, Germany has resisted the idea of collective EU debt to absorb the pandemic's economic shock.
It's wishful thinking to hope Europe's economies could bounce back as easily as these Parisians after months under lockdown. Even before the EU Commission presents its aid package, Berlin and Paris are rushing through a joint initiative for economic recovery in a bid to put this crippling phase behind them. In a joint news conference with the French president, Chancellor Angela Merkel stressed the coronavirus pandemic is endangering European unity.
That's why the fund has to help ensure that all countries in Europe can react appropriately. This requires an extraordinary one-off effort which France and Germany are ready to undertake.
This is the result of bilateral work in cooperation with our partners. I'm convinced that this plan provides the groundwork to revive our lives, our economies, and our societies.
To offset the drastic decline in production, transport and tourism across Europe, this development fund will get an injection of €500 billion. EU budget funds will be made available to the hardest-hit regions and sectors. The overall plan is designed to strengthen the EU's future viability.
These resources will of course serve this purpose. We will invest in digitalization and the Green Deal to cope with the climate catastrophe. This will inspire a new dynamic for the future. In the field of health, we will aim for cooperation to apply all we've learned from this crisis together.
That sounds like support for the EU Commission, whose economic recovery plan is being drafted. The Commission's president is expected to present it next week.
And let's get more now. We are joined by DW political correspondent Hans Brandt from our parliamentary studios. So Hans, how big a step is this, especially for Germany?
Yes, Germany has been resisting for weeks plans to issue bonds by the European Union, in other words, to go into debt, and so that Germany ends up guaranteeing the debt of other countries in the European Union. That's something the German government and conservative politicians in Germany have been refusing to do for months and years, in effect. Now what's happening is that there's a bit of a detour via the EU budget. These 500 billion euros that are being proposed will become part of the EU budget, and within that budget, in the end, Germany does become responsible for the debts of other countries. So in effect, for Angela Merkel and her government, it's been a complete about turn.
And it's by no means, we have to mention, a done deal. There's the issue, first of all, of political consensus domestically, also on the EU level. What is the biggest challenge now? I mean, is it convincing the other EU partners to come on board?
The French President Emmanuel Macron said yesterday that with Germany and France agreeing on something like this, the proposal does have a chance to get through with all the other EU countries. In the end, all 27 EU countries have to agree, their various parliaments have to agree, and there's a possible legal challenge in various countries as well because of the debt that the European Union would then have to take up. At the same time, several countries such as Austria, the Netherlands, Denmark and Sweden have already signaled that they are against these plans, as they have been for months as well. So it's going to be a very, very difficult process within the institutions of the European Union to push through this plan.
We heard Macron appealing for more European sovereignty, Merkel suggesting that changes to the EU treaty need to be made. What should we make of all of this?
Well, Macron has been pushing for a long time to force the European Union to become more integrated, especially on the financial level. This would be seen as a chance to do that, and that might need changes in the European Union treaty. That's what Angela Merkel is referring to.
DW political correspondent Hans Brandt, thank you. And let's also get the view now from Brussels. We can turn to our correspondent, Bernd Riegert, who is standing by. Bernd, the European Commission has welcomed this initiative, but it involves joint EU borrowing, as we've heard. It's been a sticky issue up to now. What could it mean for the viability of this plan?
The EU institutions, of course, welcome this bold move by the German Chancellor because it means that the deadlock in Europe can be overcome now. But there are some hurdles still in the way because the provisions in the treaty foresee that the EU is not allowed to take out loans and is not allowed to borrow money and just hand them out to the countries. There have been some cases in the past, but on a very small scale. But now this is a new development, and you need some very talented lawyers in the legal services here in Brussels to come up with a sound legal basis. And for sure, this will be challenged in European courts and also in German courts. But the Chancellor and also the French President is saying these are extraordinary circumstances. We have to come up with something. And Italy and Spain are already welcoming this step because this hints to the Corona bonds. These are Corona bonds light now. The countries are giving away the money, but they have to pay back the money over 20 years. And all member states will grant for this money, and this is something completely new.
Okay, so still a lot more work to be done when it comes to building consensus for those initiatives. But the plan also giving quite a bit more power to the European Commission. Is that another reason why this is raising some red flags around EU capitals?
No, this 500 billion euros shall be channeled through the European budget that give the Commission control over the handout of this money. And the Commission can also control how this money is used. Some countries like Italy and Spain wanted a looser hand on the money, but now the Commission has a grip on it. But on the other hand, there are the frugal four, like Austria, Finland and the Netherlands, which are still opposing this move. They say this money cannot be given away as a grant. We only want loans. We only want to borrow to our fellow member states. This problem is still not resolved, and now an EU summit has to be called to overcome this and to make a compromise on this.
Bernd Riegert with The View from Brussels. Thank you. Brazil has taken over Britain with the third highest number of coronavirus cases in the world. More than 250,000 Brazilians have been infected and nearly 17,000 have died. The government is calling in more than 150 doctors from Cuba in order to help cope with the surge.
Brazil's hospitals are running dangerously close to capacity. Rio de Janeiro's famous Maracana football stadium, now serving as a makeshift overspill facility for COVID-19 patients. Shanty towns are among the hotspots. Residents from one of the biggest in the city of Sao Paulo marched to protest against their plight. With no space for social distancing and lacking medical care, they are especially at risk. President Jair Bolsonaro has fiercely criticized lockdowns imposed by Brazil's regional state governors because of the impact on the economy, but they insist there's no alternative.
To beat the economic crisis, we have to beat the coronavirus. The enemy of the economy is not quarantine, it is the pandemic. And that is why we have to provide all the necessary support for science, for medicine, for health.
Many Brazilians are angry. They say they are the ones suffering because the authorities acted too slowly.
Brazil is in a bad state and is behind in its response. Lockdown should have been done a long time back.
People need to work. People need to eat. They're seeing the government playing politics. So nobody is taking it seriously, despite the seriousness of the problem.
The government says the worst of the crisis should be over by July, and the economy will be able to pick up from August. Not everyone shares that confidence.
Well, the coronavirus pandemic is likely to hit India's economy very hard. Goldman Sachs expecting the Indian economy to shrink by as much as 45% in the current quarter. India has just extended the lockdown because of corona, and although there has been some loosening for many, it's a challenge just to survive.
Traffic in the streets of the Indian capital, New Delhi, is on the increase again. India has just extended the coronavirus lockdown until the end of May, but it's relaxed a number of restrictions. For example, small shops will be allowed to open again, and restaurants can do takeaway business. Many merchants are celebrating the easing of India's lockdown, but millions are still teetering on the brink of economic ruin. It's difficult for us. We have to pay rent for 3 months. We have to pay our workers. It's a huge problem. We can't do anything without the government helping us. It's not like customers will start turning up the moment we open our doors. In reality, my business is down to just about 35% of what it was. I'm not getting any cigarette supplies to sell, and even those I am getting are so expensive that if I sell them, customers want to pick a fight with me. The extended lockdown for 1.3 billion people comes as the number of infections continues to rise rapidly. Officially, 91,000 people have fallen ill with COVID-19 and 2,800 have died as a result. But not enough tests are being carried out. The number of unreported cases is likely to be much higher. The measures against the spread of the coronavirus mainly affect the poorest of the population, day labourers and migrant workers. But there's the risk of further outbreaks as those workers turn their backs on major cities such as New Delhi or Mumbai and try to get to their home provinces. Now, rising infection figures are being reported in those provincial regions.
And for more, we can speak now to journalist Surabhi Tandon, who is joining us from Delhi. With the Indian economy shrinking, what does all of this mean for the country's most vulnerable?
So, the countries most vulnerable already live a hand-to-mouth existence. And with the lockdown, we've sort of seen that they were almost entirely left out of whatever measures the government took to curtail the virus, at least initially. Since then, the government has announced a series of relief measures like additional food grains that will be provided to migrant laborers, for instance, for the next 2 months, or a very basic minimum cash deposit in bank accounts. But we're really speaking about a population that has no savings, no reserves, and they require work on a daily basis just for survival. So with really no clear indication on when the government plans on opening the economy out completely, their futures, I would say, have simply been left in a lurch.
And we also know that the future for many small businesses is also at stake. Some of the restrictions have been eased. For example, small shops can open again. What is the situation for small entrepreneurs in the country?
So last week, the government announced a stimulus package of $266 billion to help the economy revive a little bit. But since, the details of this package have really come about, economists and business owners are quite unhappy. The crux is that the government is trying to create liquidity rather for supply without really trying to inject money into creating demand. It's something that you saw in your story as well. So what that happens is that at one level, small businesses have had issues with supply chains breaking, with labor going missing just because of the lockdown. But even if they are allowed to open up now, if there's no increase in demand, if the government is not going to help people recover the income losses that they've had in the last 2 weeks, without that increase in demand, the economy really can't get back on its feet. And it's the same for small business owners as well. They need demand to really be able to get their business going.
We want to thank you very much, journalist Surabhi Tandon, joining us from Delhi. We appreciate it. But first, finding people who have contracted COVID-19 before they can spread the disease and tracing their contacts has become a priority for governments across the world. Scientists in South Africa are developing an app that helps to track those contacts. If this app works, it could help make up for the shortfall in testing capacity there.
The Oranjesicht City Farm Market in Cape Town. Before the pandemic, the farmers' market drew 7,000 visitors a day. Now, just 700 arrive, and they are only allowed to buy essentials under strict procedures.
What I'm doing today, everybody who comes to the market I take their full names, I take their cell phone numbers, I explain to them the reason I'm doing it, which is for tracking and tracing in the case of COVID, being a notifiable disease.
The shoppers appear happy to cooperate.
I'm comfortable, I understand why they're doing it, and it's great that we can still get to support like local produce, but know that, I'm feeling safe and protecting, other people by not spreading the virus.
The idea is that if there's a case of coronavirus at the market, authorities can warn others who may be affected. While collecting people's names and contact details is an easy way to make contact tracing possible, it is obviously not the most effective way. An app, researchers at the University of Cape Town argue, would make things easier and more effective. Kopia Georg has overseen the development of the app COVID. Every participant can register online and will then receive a QR code. This can be saved to one's smartphone or simply printed out, as fewer than half of all South Africans own a smartphone.
I can now use the COVID app if I'm a verifier. So let's say I'm a taxi operator or I'm a security guard. I want to scan users' QR codes as they come in. So you can scan the QR code. It shows my name, it should load my picture eventually. It shows that I haven't been tested. There's no information about whether I have recovered from COVID. What has happened in the back end is that the app has sent a geolocation to the wallet of the user, and it simply has found the address of that user by looking at the QR code.
The data is not stored centrally. To address privacy concerns, the data is only stored on users' phones. If someone tests positive, he or she can agree to sharing the anonymized data with the public health authorities and to warn other users who were at the same location. Kopia Georg coordinates a team of 150 volunteers who developed the COVID app. Today, they are presenting their project in a web seminar to political decision makers from several African countries.
The research shows that in order for contact tracing to work, we need to identify 60% of the patients as soon as they have symptoms, and we need to find 50% of their contacts basically instantaneously. If you take even 4, 5, 6 days to figure out all the contacts that somebody who is positive had and to follow up with them, you will be too slow to effectively curb the spread of the virus.
But the biggest problem is the insufficient testing capacity. South Africa has already performed more than 350,000 COVID-19 tests, by far the most of any African country. But now laboratories are overwhelmed and often need more than 5 days to get a result, something that no app can fix.